Good afternoon, evening, everyone. Happy Sunday again. Thank you for tuning in. We will begin and the others will just join in. So we know October is Breast Cancer Awareness Month, hence the reason we're dealing with breast cancer and obesity today. So for those who are new to our Zoom, my name is Shireen Jirve Yar. I am the founder of Destyne Fit and Be Empowered. So before we start, I would give you a little information about Destyne Fit. So the meaning behind the name Destyne Fit is we are destined to be healthy and fit, and our clients learn how to change their lifestyle for a fit and a healthier version of themselves. So we help our clients through their journey to optimum fitness through our 21-day fitness challenges. And we coach our clients one-on-one on how they can actually upgrade their lifestyle for a fit and a healthier body and mindset. So our aim this afternoon is to be knowledgeable of breast cancer and prevention lifestyle. And we will be able to define breast cancer, to be able to study risk factors of breast cancer, and to identify the mechanics and contributing factors for breast cancer. Also, we will be able to list the symptoms of breast cancer and indicate the preventative methods of breast cancer. So breast cancer is a disease in which cells in our breast, they grow out of control. So cancer occurs as a result of mutations, right? So it's abnormal changes. So the abnormal changes happen in your genes, and your genes are regulating the growth of cells and keeping them healthy. Let me yeah. So normally the cells in our bodies replace themselves through a orderly process of cell growth, right? So healthy cells take over new cells as the old ones die out. So this is the usual process of the cells. But over a period of time, mutations can turn on genes and they can turn off genes. So that changes cells' ability to now keep dividing. So they go out of control. And now they produce more cells just like it, and these cells now form a tumor. So a tumor can be benign, which is not dangerous to our health, or it can be malignant, which has the potential to be dangerous. So benign tumors are not considered cancers. So once the doctor see you, they say you have a benign tumor, it's not cancerous. Their cells are actually close to normal in appearance and they actually grow slowly. So they do not invade your tissues or they do not spread to other parts of your body, right? Malignant tumors, on the other hand, they are the cancerous tumors. And if they are left unchecked, malignant cells eventually spread beyond the original tumor to other parts of the body. So hence the reason why you would see or you would hear persons saying if they had breast cancer, but now it's in their lungs, etc., because it mutates, right? So breast cancer can occur in both men and in women, hence the reason I have a photo of a man, but it's far more common in women. So breast cancer starts from different parts of the breast. So most breast cancer begins in the ducts, which carry milk to the nipples. So, and that's usually called ductal cancers. Some starts in the glands that make the breast milk itself, which is called lobular cancers. And a small number of cancers starts in other tissues of the breast. But these cancers are lymphomas or sarcomas, and they're not really thought of as breast cancer. So normally, the cancer that you see, you know, when people say they have breast cancer, it's either ductal cancer or lobular cancer, right? So breast cancer can spread when the cancer cells get into your blood or your lymph system. So that's how they're actually carried to other parts of our bodies. So the lymph system is a network of lymph or lymphatic vessels, which is found throughout the body that connects our lymph nodes. So the clear fluid inside the lymph vessels, they are called lymph, right? And they contain tissue byproducts, and they also contain waste material, as well as our immune system cells. So the lymph vessels carry lymph fluid away from the breast. And in the case of breast cancer, the cancer cells enter into those lymph vessels and they start to grow in the lymph nodes. So most of the lymph vessels of the breast, they drain in, like, let's say under the arm. They also do drain along the collarbone, right? And they drain inside of your chest also by your breastbone, right? So if these cancer cells have spread to your lymph nodes, there's a higher chance that the cells can actually travel to the lymph system and it can metastasize, so it can move to other parts of your body, right? Because it has entered into your lymph nodes. And remember, we said our lymph node drains in different parts. So that's how it actually moves. So the more lymph nodes with breast cancer, the more likely the cancer will be found in other organs. So because of this, finding cancer in one or more lymph nodes often affect your treatment plan. So some persons will need surgery to remove one or more lymph nodes if they have it. So whether to know the cancer, if the cancer have spread, or preventative care, they would remove the lymph nodes, right? So basically, this is how it actually works. So not all women with cancer cells in the lymph nodes, they develop cancer in other parts of the body, right? Some women with no cancer cells in their lymph nodes actually develop cancer elsewhere also. So it's really a little tricky. It all depends on your body, but this is generally how it works. So some of the signs and symptoms of breast cancer include a breast lump or a thickening that feels different from your surrounding tissues. So you know your breast, you look at your breast, you know how the tissue feels around your breast, right? So this, once you have breast cancer, it feels different. The tissues are more thick. And there will also be a change in the size and the shape or the appearance of your breast. So changes to the skin over the breast, such as dimpling and inverted nipple. Also peeling, some persons experience scaling or crusting of the nipple or the areola of the breast, and redness over your breast, and the skin, it's like an orange. The texture of an orange, that's how it appears, right? And that's how it actually feels also. So these are just some of the signs and symptoms that you can look out for with breast cancer. So making changes in your daily life, it may help reduce your risk of breast cancer. So you want to ask your doctor about breast cancer screening. You want to discuss with your doctor when to begin breast cancer screening, such as mammograms, right? So you can do your breast self-examination, but when it comes to mammograms, you have to go to the doctor, all right? So you want to become familiar with your breasts through the self-breast exam, sorry. So when you become familiar with your breasts, you will observe if there are any changes or if there are lumps or any unusual signs in your breast. So breast awareness can't prevent cancer, but it may help you better understand the normal changes that your breasts undergo and identify any unusual signs and symptoms. All right. So for some persons, you would realize during your menstrual period, your breast changes. So some people may have lumpy breast tissues during their monthly periods, right? So you have to become aware with your breast. So you want to examine how your breast feels before your period. You want to examine how it feels during your periods and after your periods. So which means you will be really aware of how your breast looks, how your breast feels, right? So I will give you a minute to look at this screen because I have the breast self-examination there. So if you are not sure how to do a breast self-examination, that's an example. So I'll just give you 1 minute. Okay. So causes and risk factors of breast cancer. So researchers have identified hormonal, lifestyle, and also environmental factors that may increase your risk for breast cancer. But it's not clear why some people who have no risk factors develop breast cancer, yet other people with risk factors, they never develop breast cancer. So it's likely that breast cancer is caused by a complex of interaction with your genetic makeup and your environment, right? So we have inherited breast cancer. So doctors estimate that about 5 to 10% of breast cancers are linked to gene mutations, which actually pass through generations of a family, right? Then you have so a number of inherited genes that increases the likelihood. They have been identified and they are breast cancer gene 1 and breast cancer gene 2. So both of which significantly increases the risk of both ovarian and breast cancer. So if you have a strong family history of breast cancer or any other cancer in your family, your doctor may recommend a blood test to help identify those genes. So you can do a test that would identify if you have the gene 1 or if you have the gene 2, which would make you more prone to inheriting breast cancer or even ovarian cancer. Just give me 1 minute, guys. Something came up on my screen. Okay, I'm back with you guys. So, yes, so you can ask for a blood test if you know you have a strong family history, right? Of breast cancer or ovarian cancer in your family. So also late childbearing, you have also persons who have early menstrual or late menopause, also persons with obesity, increased breast density, prolonged use of oral contraceptives, and hormone replacement therapy. This is some women take hormone replacement therapy after menopause, alcohol, and tobacco. So the more weight you actually gain in your life, the higher your risk for developing breast cancer after menopause, right? Having more fat tissue can actually increase your chance of getting breast cancer because it raises your estrogen levels. So the higher risk is because there are more fat cells, and more fat cells mean you will have more estrogen. So extra fat cells gives you more estrogen in your body, and estrogen can make hormone receptor positive breast cancer, and it can develop and grow. So hence the reason that there's a link between obesity and breast cancer, right? So more fat cells will give you more estrogen, and more estrogen will increase your risk of developing breast cancer. Also, women who are actually overweight, they tend to have higher levels of insulin, which is another hormone, and higher insulin levels also have been linked to some cancers, including breast cancer. So having extra fat in your waist, and we know that is where a lot of us put on our weight, this may raise your risk factor more, right? So once you carry your fat in your abdominal area, you are at an increased risk for breast cancer also. So how much does weight affect your breast cancer risk? So in a group of 100 women with healthy weight range, about 9 will probably develop breast cancer at age 50 or above. In a group of 100 obese women, about 11 or 12 will probably develop breast cancer. So being obese causes about 2 or 3 extra women out of every 100 women to develop breast cancer at age 50 or above. By keeping a healthy weight throughout your life, you can actually reduce this risk. So breast cancer risk factor is anything that actually makes you more likely to get breast cancer, right? So having one or even several risk factors, it doesn't necessarily mean that you will develop breast cancer. Many women who develop breast cancer have no known risk factors other than simply being a woman. So factors that are associated with increased breast cancer, they include being female, as I said. Women are more likely than men to have or to develop breast cancer. Although we did say in the start of the presentation, men do have breast cancer also, right? It's just generally women, more women who develop it. So increasing age, your risk of breast cancer can increase as you age. Beginning your period at a younger age. So once you begin your period before age 12, it increases your risk of breast cancer. Beginning menopause at an older age. So if you began menopause at an older age, you are more likely to develop breast cancer. And you will see these are some of the things that we mentioned in the photo before with the risk factors. I think that was about 2 slides before. So a family history of breast cancer. So if your mother, your sister, or your daughter was diagnosed with breast cancer, particularly at a younger age, your risk of breast cancer has increased. So we still have to remember that a lot of persons who are diagnosed with breast cancer, they have no family history also. So a personal history of breast cancer. If you have had a breast cancer in one breast, or you have had increased risk of developing breast cancer, you would have increased, risk of developing breast cancer in the other breast, right? So you need to monitor that also. The inherited genes, as we said, it can increase your risk factor. One theory present in the media is that taller people have more cells in their body growing and dividing with more potential to undergo cancerous changes. So the higher food intake is needed to maintain a larger body size may also play a part. So I am not saying that this is very popular, but it is said that taller people get breast cancer because of that. So radiation exposure. If you receive the radiation treatment to your chest area as a child or a younger adult, your risk of breast cancer is increased. Having your first child at an older age. So women who gave birth to their first child after age 30 have an increased risk of breast cancer. So if you are thinking about having a child, just look at your age. I'm not saying don't have a child, but it puts you at an increased risk of breast cancer. Also, if you never had children, you never was pregnant, women who have never been pregnant have a greater risk of breast cancer than women who have had one or more pregnancies. And as we said before, obesity increases your risk of breast cancer. So post-menopausal hormone therapy. Women who take hormonal therapy, which combines estrogen and progesterone to treat the signs and symptoms of menopause, they have increased risk of breast cancer. So the risk of breast cancer decreases when the woman actually stop taking these medications. So if you are going through menopause, they can, and it's really, really bad, the doctors can suggest that you go on a hormone therapy treatment. However, just bear in mind that it would increase your risk of breast cancer. But once you stop taking the therapy, it removes that risk. So if you really have to go on it, try to see how short a time that you can use that treatment for. So drinking alcohol increases your risk of breast cancer also. And the ways we can reduce our risk for breast cancer is obviously reducing our alcohol intake, having a healthy weight. You want to be active. If possible, you want to have your kids at an earlier age. You want to also breastfeed if possible. You want to eat well, so watch your diet. Try not to stress. I know it's very difficult not to stress, but you want to be able to manage your stress or get good coping mechanisms, right? No smoking, and you want to also, as we said before, avoid long-term use of hormonal replacement therapy. So we can reduce our risk with exercise also. So how exercises actually lower our breast cancer risk is not fully understood, but it's thought that physical activity actually regulates your hormones, which includes your estrogen and your insulin hormones. So, and we said before, these two hormones, they are the ones that fuel the breast cancer growth. So regular exercise can help women stay at a healthy weight, which will help regulate the hormones, and it will help keep your immune system healthier. So many studies have found that exercise is breast healthy habits. So exercise most days of the week. You want to aim for at least 30 minutes of exercise on most days of the week, right? At least 3 days for the week, if you can do 5. So if you haven't been active lately, you want to start slow, right? The American Cancer Society recommends all adults engage in at least 150 minutes of moderate intensity exercise or 75 minutes of vigorous intensity exercise each week, preferably spread throughout the week. So if you're going 3 days for the week, or you're doing exercise 3 days for the week, you can just do Monday, Wednesday, Friday, right? Spread it out. So some examples of moderate intensity activities include brisk walking. It includes bicycling, yoga, and yard work can be considered, which is like garden maintenance, etc. So this is moderate intensity. Vigorous intensity, and that's 150 minutes per week for those type of exercises. The vigorous intensity is jogging or running, swimming. You also, if it is you're doing bicycling, fast bicycle. So, and remember, 75 minutes per week for vigorous intensity activities, right? So another advantage to exercising is that when you're exercising, you aren't just sitting. So evidence is growing that sitting, no matter how much exercise you get when you aren't sitting, it increases your likelihood of developing breast cancer and some other types of cancer, and also as well as obesity, type 2 diabetes, and heart disease, right? So for many of us, working means sitting at a desk for long hours, and that makes it even more important to incorporate activity in your day. So you want to limit your time spent watching TV and other forms of screen-based entertainment, because you would realize you'll be sitting during this time. You want to use a stationary bike or a treadmill when you do watch TV. So if you do have a treadmill at home, you can put it close to your television. So when you're watching television, you're on the treadmill, right? If at your job you have an elevator, you want to use the stairs rather than the elevator. If you can, I know this is not possible for everybody. You can walk to your destination if it's close by. You want to, if there is a gym available close to your workplace, you can exercise at lunch, right? So it all depends on your environment. You look at your environment and you just see how possible it is. That it's just a matter of you trying not to sit for long periods of time, all right? So for persons who haven't exercised in a while, it makes sense to start slowly and then you want to build gradually. And if it is that you have any issues, you want to clear it out with your doctor before. So you want to take exercise break at work to stretch or a quick walk. Sometimes, instead of sending an email, we can walk to our co-workers' station. I know during COVID now, it's better that we send the email. So in a case like that, we just stretch our legs, right? Or a lot of us, we work from home now. You can dance with your family at home, put on music and do some dancing that can be considered as exercise, right? I know a lot of us, we're not going on any vacations right now due to our situation. So a lot of persons, they use the pedometer, right? Watch, you know, a lot of us have smartwatches, etc. So you want to actually follow through the steps and give yourself goals. So you want to increase the number of steps daily. So if you say you'll start at 2,000, then tomorrow you'll go up to 5, and you keep going up, right? And if possible, you want to actually do some sports. But I know right now, that's a little impossible, all right? So as we said, we want to drink alcohol in moderation, if any at all. So you want to limit the amount of alcohol you drink, no more than 1 drink a day, if you choose to drink, all right? So limit postmenopausal hormonal therapy, as we said. So you want to talk to your doctor about that. Some women during menopause, they experience bothersome signs and symptoms. You would see it have them stressed out. And if you really need to take the hormonal therapy, then you want to talk to your doctor. You really want to talk to him about it. And probably go on the lowest dose possible for the shortest period of time. This is in the hormonal therapy treatment, right? So we said maintaining a healthy weight. So if your weight is healthy, you want to work to maintain that weight. If you need to lose weight, you want to actually do something about it. So you want healthy strategies to lose weight. You want to reduce the number of calories you eat each day and increase the amount of exercise that you actually do, right? So eating fruits and vegetables, whole grains, legumes, nuts. So basically eating a healthy diet, healthy fats, using olive oil over butter and fish instead of red meat. These are some of the ways or things that we can actually do also to decrease our risk for breast cancer, right? And you would see on the screen, there's some other foods that we can incorporate into our diet that can help us prevent breast cancer. I will just give you a minute to look at it. So I know we are starting to open up, I think it started already. Yes, the restaurants to dine in for persons who are fully vaccinated, right? So you want to know how to eat healthy at restaurants at this point in time. This is actually what will guide you. I'm giving you some steps here that can guide you for healthy eating at restaurants. So you want to enjoy a salad with a fat-free dressing before going out. So sometimes we want to go out to eat, but we don't want to eat before we go because we know we're going to eat, right? So you want to try to curb your appetite and keep you from overeating. So if you have a salad, you can have a salad like 30 minutes before you leave the house. So you want to go with a plan at the restaurant. You want to look at the menu online because everything is online right now, and decide what you want to eat before getting to the restaurants. And a lot of restaurants are now offering healthy menu options now. You want to choose steam, bake, or boil vegetables rather than those in sauces or with cheese, right? You want to order your meat that is actually steamed, broiled, roast, or baked rather than pan fried or deep fried. You want to ask for sauces, dressings, or whatever it is, if they're even giving sour cream on a side, so that you can control how much you use as opposed to letting them put it on your meal. Or you can even ask for your dish to be made without the sauce. You want to avoid casseroles because they have sugary or salty sauces that has a lot of high fat cheese in it. Avoid or limit alcohol. As we said, alcohol beverages have no nutritional value. And once you get out and you have a few, you are more tempted to have more, and then you are more tempted to eat more. All right. You want to choose beverages without added sugar. So a 12-ounce glass of regular soda has about 10 teaspoons of sugar. Water has no calories. So you want to order each item separately also, right? Like an a la carte menu. So you can get everything prepared how you want it rather than ordering combination, which is actually less flexible. So don't eat mindless. You want to ask the waiter to remove the bowl. They give you bread before. You just have your one piece or your two pieces, and if there's any left, you want to ask her to remove it because you don't want to keep going back. You also don't want to order jumbo size or super size. Order an appetizer portion instead of a meal size portion. So, or if you go to the restaurant with someone, you all can actually share the meal since it's a la carte, right? Or wrap it up and eat half and ask them to wrap it up so you can eat it for lunch next day, right? So there are different options that you can actually use. I think this is the same, yeah, this is what I just said, right? So I think that's our last slide here, second to last slide actually. So how can we help you? We can help you with in regard to exercise, because we said creating a healthier lifestyle by exercising, right? You can exercise from the comfort of your home. We do a 20-day workout challenge. In our 21-day fitness program, we have a 20-day workout challenge. So basically in that 20 days, we have 20 exercises that you choose from. You can choose 1, 2, or 3 exercises. And every day we increase by 5. So we start at 5 and we move up to 100. And every day we increase by 5 for 20 days. And that's our 20-day workout challenge. So some persons, they do sit-ups. Some persons, they do jumping jacks. So these are stuff that you can do at home and you increase daily as you go. So this is something that can actually help you if you're not accustomed to exercising. It's very, it's a good place to start, right? And our fitness challenge, on the other hand, it focuses on our diet. So we have the 20-day workout challenge, which focuses on exercise, and we have the 21-day challenge, which actually focuses more on your diet. So if you want to keep a healthy weight and reduce your risk for breast cancer, then our 21-day fitness program can actually help you get started in regard to that. You would receive a meal plan. You would be added to a support group, and you would receive one-on-one coaching, right? So if this is something that you may be interested in, then just let me know. You can just WhatsApp me and tell me you want to get more information or you want to get started on our 21-day or 20-day challenge, right? And just ask you your goals so we would be sure on where you stand, and then we can get started. But these are some of the ways we can actually help you reduce your risk for obesity and breast cancer, right? So this has brought us to the end of our presentation. Are there any questions? If you have a question, you can just feel free to unmute your mic and ask it, or you can place it in the chat.
Hi, Shireen.
Hi.
It's Amin here. It
Yes,
just
I'm
seen a
hearing you.
different picture. Yeah. My question is, two questions I have, right?
Mhm.
How often should you take a mammogram? Are you hearing
It
me?
all depends. So when you do your first mammogram, they would let you know if it's normal or abnormal, right? Once it's
Mhm.
a normal mammogram, they would tell you if they want you to come back in a year, in 2 years. So it all depends if you have a normal or abnormal. But more I would say if it is that you have a normal mammogram, probably doing it a year or two. But once you have abnormal, you need to get it checked.
Okay. Second question. Now, if there isn't any trace of cancer run in your family, is it wise or should you take a mammogram?
If you have cancer in your family, you said,
If you don't have a
or if
trace
you
of
don't,
cancer
yes, you
in
should
your
take it.
family,
You should still
eh?
take it. Yeah, you should still do the mammogram because remember,
Um,
there's a lot of women who don't have a family history of breast cancer, and they still do get breast cancer because of environmental factors that we spoke about, right? So yes, you should still take your mammogram test and then follow through.
okay, well, let me ask another question.
Mhm.
By taking mammogram and you don't have a trace of cancer, will the machine give you, will the radiation from the machine give you cancer?
Well, research has shown that the radiation issue is earlier on in life. So, when you are a young adult or a child, if you were exposed to a lot of radiation to your chest area, that can increase your risk. But at that age, no. So go ahead, feel free and go ahead to do the mammogram. And the thing is, it's not like you're doing this every 3 months or every 6 months, right? So that shouldn't affect you.
Could I give you the reason why I asked that question?
Yeah.
Okay, the reason why I asked that question, some years ago when Petrotrin was still up and running, I wanted to take a mammogram, but there isn't any history of cancer in our family that I know of. And when I went to the doctor advised me, because I don't have a history of that, they advised me not to take it. The reason why they did it too is because the doctor had told me by taking a mammogram, sometimes the machine could give you, the radiation from the machine could give you the cancer. Now, I went on the outside, and because I wanted to take it, I went on the outside and it had a mobile clinic. And when I explained to them, they said and to take it in Southern Medical.
Right.
So I took it 2 times, no, not Southern Medical, in Augustus Law. So I took it 2 times already. And since that, I have never taken another mammogram.
Yeah, the thing is, it's different schools of thought, but you want to actually do it to ensure. At least, you see, so you say you did twice already, right? And it was negative.
Yeah.
So that's good. So you know where you stand. Because remember, even though you do your mammogram, you still want to keep doing your self breast examination, right? So your mammogram is one side of it, and then you keep monitoring your breast. So I will advise that at least, you know, for persons who have never done it before, that you go and get one mammogram at least and see where you stand. Because I mean, one exposure to radiation is nothing to increase your risk, as opposed to living an unhealthy lifestyle. Yeah.
Should you take, I can't remember if you answered that question, but I'll still ask. Should you take a mammogram every year or every other year?
Yeah, you asked it. So I told you, depending on what your results are, so you can do it. I would suggest yearly or 2 years, right? Within that period of time. But they should tell you what's your results and when you should come back, you know, to keep checking. But 2 years is fine.
Okay, thanks. That's all the question for today.
No problem. Let me see. Any other questions? I'm seeing some messages, but my computer is acting up, so I'm not even getting to type in the message. I will not, so let me just, Minute, I can't respond on the chat because my computer is acting up, but I will not read, but I will just respond. So basically, I think you should recheck, right? You should do a recheck within 6 months to 1 year. Any other questions? Any comments? Okay, guys, so if we don't have any more questions or comments, feel free to reach out to me. Feel free to reach out to me. My number is 724-8199. I cannot put it in the chat. So you can reach out to me if you want to ask me something separately, you know, yes, I'm available. So if you want to join our challenge, let me know. We have October challenge going on right now. So guys, if you don't have any more questions or comments, thank you very much for joining us today. I will see you next Sunday, hopefully. Right? I think next Sunday I will be dealing with obesity and immune system and the immune system. I think that's what I'm looking at. So I will keep you updated. Have a pleasant week and a pleasant night, guys. Bye-bye, everyone.
Bye-bye.
Bye.